Hi there, this is Joel Steinberg from Type 2 Diabetes Transformation. Today we're going to have a discussion about your lab results and your discussion with your endocrinologist about them. It's really helpful if you understand your lab results and not just give them to your doctor and have your doctor tell you what to do. So the first point I want to bring up is that it's really helpful if, as someone with type 2 diabetes, you see an endocrinologist as opposed to a general practitioner. Many general practitioners don't know enough about type 2 diabetes. Most endocrinologists know the standard protocols and understand what to look for and what meds to give if you need meds and how to apply them. So I want to encourage you to see an endocrinologist. The next thing that's important about seeing an endocrinologist is it's really helpful if you just don't go to an endocrinologist, show me blood work, and him tell you what he wants to tell you. You can earn his respect, and you can end up having a better dialogue with your endocrinologist, and he'll be more impressed with your desire to control your type 2 blood diabetes. If you know that you are understanding your lab results as opposed to just being asked what they say. A few important things to know about your lab results, and I want to go over them with you. The first thing, of course, is your A1C. Your A1C tells you what your blood sugar average has been over 60 to 90 days, with a slight weight more towards the 60 as opposed to the 90 days. It's an average blood glucose. So it tells a pretty good story, but not the whole story. The reason why it doesn't tell the whole story is that if you're not taking meds, especially not taking more current meds, and you can have, for example, hypoglycemia sometimes, which is low blood sugar. Your low blood sugar and your high blood sugar may average out to a normal blood sugar, which will make your A1C look fairly normal. That's a little bit deceptive, and that's why there are two other numbers that you should be looking at. One of those numbers is your time in range. Your time in range tells you how long you've been within the range of your A1C between your blood sugar between 70 and 180 during the day. If you've been over there 75% of the time, you're doing great. I don't expect that at first from you all, and I don't expect you to hurry up to get there. You're much better off developing a system like we talk about and finding out how to get your numbers between, your time in range between 75 and 80% over time. The next thing is glucose variability. Glucose variability is like a roller coaster. You're better off pretty consistently within that range of 70 to 180, not going real high and real low. That shows that you're controlling your type 2 diabetes pretty well. It's another reason why continuous glucose monitors are great, because it really tells you about your time in range and your glucose variability, in addition to just showing you what your blood sugar is. However, some people can't get those, especially if you're not insulin dependent. I've had type 2 diabetes for 38 years, a little more now, and I'm 75 years old. I haven't always been as healthy as I am, but now I am really healthy. But over the years, I've had difficulties. 8 or 9 years ago, I had a bypass surgery. I've had a heart issue, and I've had kidney issues. So one of the numbers that I do look at is my numbers that relate to my heart, cholesterol, and all the related numbers of cholesterol. And you should know those, and you should take a close look at them and discuss them with your doctor to see if they need to be improved. Another level is that's important is kidney. Your eGFR tells you a lot about your kidney levels. It's called estimated glomerular filtration rate. Normal is under 60. But if you've had type 2 diabetes for a long time, it's likely not going to be under 60. However, mine is like 90, And so I'm level 3, but my doctors tell me I will not need dialysis until I'm over 100 years old. And that's because I take good medicines for it. I take Farxiga, and Jardiance is similar to that. Farxiga is also good for lowering your blood sugar. And I also take Kerendia, which is another drug that helps your kidneys. Another drug that's good for kidney disease. Another way to test for your kidney disease is to check for your creatinine levels. That'll raise a concern. And also your microalbumin creatinine ratio is another level that is in your urine test. Look at that, and your doctor will look at that. And that will give you an idea if you need medicine for your kidneys, like Jardiance or Farxiga, which are similar, and or Kerendia. A few other lab results you want to look at are your red blood cell counts. It will kind of tell you if you've got anemia, protein levels, and if you have urine in your blood, that's something important to look at. But you want to balance protein. It's important to have a lot of protein every day. I have 3 eggs every day, but my cholesterol levels are healthy, and my heart is healthy, even though I had heart bypass surgery over 8 years ago. So I'm happy to report that I'm magically healthy, and you can be too, at age 75 like I am. All you need to do is keep an eye on your blood sugar levels, control your blood sugar, take meds if you need them, discuss your meds with your doctors. Most endocrinologists know the protocol that you need to take. So I just want to encourage you not to just focus on your A1C. Take a look at our free guide, and you can look at our sales page and sign up for our programs, sign up for our link, and look closely at our programs. And I think our programs are composed of just the diabetes book. You can also add worksheets, and you can also add videos. The entire program will help you be conscious of your situation. One of the chapters, for example, is on mindset. And there's a great book by Carol Dweck, D-W-E-C-K. She talks about growth mindset versus general mindset. You want to have a growth mindset. You want to be looking forward and have the confidence that you can improve yourself. I've improved myself, and you can too. Have a great day, and thanks.